Do you suffer from symptoms of heartburn or have been diagnosed with GERD? Still confused about what it really is? Hi there, I'm Dr. Michael Kaye from the Center for Functional Health, and today we're going to break down what heartburn and GERD really is and how it affects your health. Well, despite its name, heartburn has nothing to do with your heart, but it certainly feels like it sometimes. The main symptom of heartburn is a burning pain in the chest that typically starts after eating or drinking. Now, this pain can often worsen when you lie down, and it can also be compromised by an unpleasant taste in your mouth and difficulty swallowing. It feels like something is stuck here in your throat. Heartburn is caused by acid reflux, which happens when acid from your stomach flows into your esophagus, this area through here. The pain you experience is because the lining of the esophagus is far more sensitive than the stomach lining. And when acid becomes a chronic condition, it's called gastroesophageal reflux disease when acid chronically comes up through the esophagus. Now, GERD and heartburn can have serious health consequences, including an increased risk of esophageal cancer and esophagitis. That's why it's important to have an endoscopy. An endoscopy is a test where they'll stick a tube down your throat into your esophagus for a better look. Think of it as like taking a look under the hood. Now, most people, and even some doctors, fail to realize that there may be a correlation between GERD and irritable bowel syndrome. And I'll talk a little bit more about this later in the video. Now, it's important to note that these symptoms, if they're new to you and you're having severe chest pain or other signs of a heart attack like arm pain or a jaw pain or shortness of breath, you need to get immediate help. And I tell my patients that if they're experiencing this chest pain and jaw pain or feel like they're having a heart attack, they should report immediately to their local emergency room. It's always better to be safe than sorry. Now, many assume that the cause of heartburn and GERD reflux disease is simply excess stomach. However, studies show that heartburn and GERD are increasingly common with age, and we produce less stomach acid as we age. The typical approach to addressing heartburn and GERD is to slow the production of stomach acid. No wonder these treatments are often ineffective in the long run. They don't address the root cause and only mask the symptoms temporarily. In fact, sometimes they can make a bad situation worse. Over-the-counter antacids like Tums and Maalox can cause constipation, for example. Other treatments such as proton pump inhibitors like Prilosec can impact the balance of bacteria in your gut with far-reaching effects, especially with long-term use. Now, suffering with heartburn or GERD for many years can be painful and debilitating, and that's why it's important to get to the root cause. So what really causes heartburn and GERD? Now, mainstream medicine would have you think that it's simply an overproduction of stomach acid, but many studies believe otherwise. So let's take a step back, because the esophagus is so sensitive that any amount of acid that comes up from the stomach can be harmful. That's why the lower esophageal sphincter is like a valve. It acts as a one-way gate and allows food and liquids to go into the stomach and also keeps the stomach acid from escaping into the esophagus. Now, with this in mind, it makes sense that the root cause of heartburn isn't necessarily an excess of acid that must be somehow stopped. Instead, it's a malfunction of this sphincter. Several things can cause the lower esophageal sphincter to perform ineffectively, including overeating, obesity, lying down after eating, bending over with a full stomach, and a hiatal hernia. Most people with heartburn and GERD notice the impact of these things on their symptoms, and it certainly makes sense that abdominal pressure would cause the stomach contents to travel backwards into the esophagus. A vital element is often missing from the conversation, and that's the role of gut bacteria. Research shows that a bacterial imbalance in the intestine produces enough gas to create the same kind of pressure which pushes stomach acid into the esophagus. The role of bacteria also explains the correlation between GERD and irritable bowel syndrome, since IBS is also the result of gut bacteria imbalances. This bacterial overgrowth is triggered by maldigestion of carbohydrates. Somewhat ironically, reduced stomach acid contributes to further bacterial overgrowth. The resulting gas leads to a malfunction of the esophageal sphincter, so acid escapes the stomach into the esophagus. This dynamic highlights the difficulties with proton pump inhibitors as a treatment for GERD. If they treat bacterial overgrowth, ultimately they may contribute to an increase, not a decrease in GERD. As you can see, the causes of heartburn and GERD are more complicated than we think, and the role of our gut bacteria plays an important role and needs to be brought into the conversation more often. I'm sure by now you understand why it's important to look for the root cause of gastroesophageal reflux disease. Now, if your symptoms of heartburn and GERD are due to bacterial overgrowth caused in part by a shortage of stomach acid, there are some steps to address this root cause. You want to aim for a diet that prevents bacterial overgrowth and protects stomach acid. The food you consume plays a big role in your bacterial balance. Focus on complex carbohydrates like sweet potato and steel-cut oats. You want to avoid overly processed foods marketed as low carb. Eliminate artificial sweeteners and reduce fructose consumption. Avoid foods extremely high in fiber as they can contribute to increased gas. Follow a low FODMAP diet and do your best to restore a level of stomach acid. Depending upon the clinical presentation and the cause for a patient's reflux, I may recommend the following: tiny doses of bitter herbs like dandelion root, ginger, gentian root, ginger, milk, thistle, and caraway, apple cider vinegar, lemon juice, and unpasteurized honey. And so sometimes I'll use hydrochloric acid. However, the hydrochloric has to be used under supervision, as you need to get the right dose. And lifestyle changes, as avoiding drinking too much water with meals, which can actually dilute stomach acid, and create a window of at least 2 to 3 hours of no food before bedtime. And lastly, I like to work on restoring beneficial gut bacteria and the gut lining. The end goal is to bring bacterial balance back to your digestive system. Probiotic supplements can help to restore good bacteria, and fermented foods and drinks are even better options since they contain other beneficial nutrients. Now, this includes yogurt, kefir, kimchi, sauerkraut, tempeh, and kombucha, but be careful of kombucha because of the high sugar content. Also, keep in mind, avoiding certain medications like steroids and aspirin, ibuprofen, that's important because that can irritate the gut lining. And finally, reducing stress, which can also damage your stomach lining. So stress reduction strategies are always a good idea. Don't let the pain of heartburn and GERD keep holding you back. All right, that's it for now. We'll see you soon. Stay healthy and strong.